Oh, hi there. Are you preparing for your Rcsi aptitude test? That test that you need to pass before your name can be in the register of the Nurses and Midwifery Board of Ireland, so that you can practice as a staff nurse here in the Republic of Ireland? Then stick with me, because this video and subsequent short videos are going to give you vital tips that will help you pass this test. Before we continue, let's have a quick glance on what this Rcsi aptitude test is all about. Right? So the test is for foreign general nurses. So general nurses who are coming from overseas. And it's in two parts, part 1 and part 2. Both parts of the test are based on the standards and requirements for nurse registration education program. Okay? Which same as what a newly qualified general nurse here in the Republic of Ireland can achieve. Okay, and the aim of the test is to assess if you, who are coming from a different country, overseas nurse, if you are good enough, if you are wealthy, if you are suitable for your name to be in the register, so that you can practice. Not just they need somebody, so you're coming in. Part 1 of the test is the theory type, so MCQs, which must be successfully completed before you can move on to part 2. And these tests contains 150 questions on a computer that needs to be answered in 3 hours. However, if a candidate finish after just 1 hour, he or she is allowed to go out if he or she wishes. The test is computerized, based on a computer in a computer room, and you behind your computer. So you read your question, you click on your answer, and you submit. So the content of the test, what the test contains. So basically all nursing stuff, nursing things that we do at the ward. All informations are at the Rcsi Aptitude test site. So say code of professional practice or code of conduct, scenarios on care prioritization. So bits and pieces of all these. All right. So what you do at the ward, what are the next, what do we do? Medication calculation to give medication, identifying errors in your medication administration sheet or your cardex and all that. So every information, as I said, is at the site. Now to the part 2 of the test. So the part 2 of the test is the OSCE type. The practical aspects. You're going to speak, perform, convince the assessor that you are capable of practicing here. You're capable of taking care of the vulnerable patients. So that test has 14 stations, and you have 10 minutes to finish each station. So basically, it's sort of performing both speed and accuracy, because if you're not convincing the assessor in that 10 minutes, you will not be passed. So the component of that test is basically what I already said. So it's basically same as general nursing care that you provide at your own country, in a ward setting, an acute setting. So one basic function or competency that a nurse must have, communication, is part of the test. So you're communicating to patients, you're communicating to patient family, solving problems, bits and pieces of all that. Medication administration, you're going to have that, because we do, and it's a core part of nursing. Attending to acute situations, emergency situations, it normally happens. So these you can have. Dressing wounds of your patient with wound. All these are some of the things that you can have or can appear at the test stations. There are more to that. Visit the RCSI site and then read, and you abreast yourself with all these. And that's for that station. So now to the tips, which is important. So the first tip is reading. Read everything at the site. Visit the site daily and read. No matter how genius you are, if you don't visit the website and read the information there, you cannot provide what the assessor wants to hear. Get a notebook. Get a notebook and prepare notes on what you are reading. Group whatever you are reading, and then you'll be conversant with which one you're going on. So say for conditions, medical conditions, that is at the site, or medical conditions, you group them. Health education, you group them. So anything that come after health education, therapeutic, or solving problems, all that, you group them. So what I mean is just group them to make it simple for you to read and understand and to remember at the test dates. Make a timetable. Draw a timetable for yourself, study timetable, so that whatever time that is suitable for you, say if you can use 1 hour, 2 hours a day for studies or for learning, then you use that. So, schedule your time. Schedule your time in studying. Practice talking, because remember, the OSCE is about talking, performing, and all that. So practice talking, reciting with yourself on the mirror, or talking to somebody who is familiar with what you're talking about, familiar with the information you are giving, so that if you're giving a wrong information or you are sliding a bit, that person can bring you onto your toes. Practice talking with somebody who is familiar with the information you are giving. Practice with somebody who is also preparing to write the Rcsi Aptitude test. Somebody who has done the test before is also okay to practice with. Somebody who has previously done the test and has passed. Practice with that somebody because he's familiar with what the test is about. He or she has been there before. Learn with friends. Learn with people who are also going to prepare or who are preparing to do the same test. So sort of group discussions or study group, because everybody giving his or her view will help you stick into your mind. So practice with other people if you have in preparation. Be familiar with the items you're going to use at the test center. So say if you're going to do observations and you're going to check patient blood pressure, and back in your own country you're using the mercury type of thermometer, the mercury type of blood pressure monitor. Here it's not used here. Here in Ireland they use the Dynamap or the digital one. So get something of that sort and practice with. Be familiar with that, or watch videos of how it's being used. So be familiar with the things. If you're going to dress a wound and there's forceps that you're not familiar in using them, practice using those before the test day. All right. Now, moving on to the test day. That's the last tips I'll give you. So at the test day, as I said, you will be the candidate as a nurse, and the assessor be the patient and your assessor as well. Arrive at the test day, arrive at the center on time. So the time or the specified on your test invitation sheet that they will send you via email. So be there in time. All right. Be confident. Be confident with yourself, because you are a qualified nurse who is coming from your country to a new environment. There's nothing different. It's basically the same practice. So be confident with yourself. And focus on whatever you're doing at the test day, and what you're practicing, or what you are doing with talking or anything. Focus. Now listen to your assessor. Listen to what instructions the assessor gives. So flow with the assessor. So say the assessor asks you to perform hand hygiene, then you as a candidate is reciting the process, or the steps in hand hygiene. That is not what he or she asks. She asks you to perform. So flow with the assessor. Listen to instructions. Don't go to the test center with pre-prepared mind. All right. So that is why I say read and be familiar with whatever you're going to say at the center. Observe non-communication aspects, non-verbal communication. I meant to say non-verbal communication signs from the assessor. So sometimes when things you are saying is not right, they don't give you a nice facial expression. So whilst you're observing the communication and non-verbal communication signs that they give, and then you as a candidate put on a nice facial expression. Don't go to the center doing your test with a squeeze face. At your ward, you don't squeeze your face to your patient. So it's the same thing. Go with a nice facial expression, and then do away with all bad habits, all bad attitudes. So say when the assessor asks you to speak well, or speak to his or her hearing, you don't shout. Speak politely. Speak politely that the assessor can hear. You don't go overboard shouting. You speak at what he or she can hear. And then remember the golden words, right? So please, thank you are simple things that you say in your ward when you're going to perform, say, a temperature of a patient. You just say, please, can I check your temperature? And then when you're done, oh, thank you for letting me checking your temperature. So all that are important. Be vigilant and listen to clues. Example, when the assessor you ask the assessor, do you have any idea about this condition? And the assessor say no. And then you rephrase the question. Have you heard about this condition before? It's similar. All right. So the assessor give you some clues. How he or she will answer you will give you a clue. Think positively. Think that this test you can pass. But remember, if you don't read, thinking positively is not going to do you any good. You're not going to pass. Read, prepare, and for that ends the tips for today. And I'll see you in our next video. Good luck, and I wish you well. You pass, and we'll see you soon in any ward.